Now that you've done that, you want to thoroughly assess the patient. So do a trauma and blood sweep, basically checking for any other injuries. In this case, we don't have any, so we'll carry on. If we did, let's say, bleeding somewhere, obviously we'd look at controlling that first. As the patient has quite high levels of oxygen, we'll be using the nasal prongs to administer oxygen to them. This one here, you can administer 20 to 40% oxygen at a flow rate of 2 to 4 litres per minute. Once the oxygen is on the way, you want to obviously look at administering the patient with appropriate pain relief. I've had a talk with the patient, 1 being almost no pain and 10 being worst pain they've ever had. They've advised at a scale rate of 8. So opted to using ethoxyflurane, which is this unit here. In adults, you'll be able to use 6 milliliters. So there's 3 milliliters in a bottle, which you add to the unit. And then with an adult, you're able to use a total of 6. So 2 bottles. With pediatrics 12 and under, you can use a total of 1 bottle. Indications would be the patient is in moderate to severe pain, which this patient is. Obviously, prior to this, you want to ask the patient if they've got any sort of allergies to this or other drugs. If they don't have any allergic reactions to this, you can proceed. You want to advise them along the way what's happening. Now, contraindications for this particular one is known renal impairments. If the family or the individual themselves have a history of malignant hypothermia, if they cannot obey commands because the patient needs to themselves administer the unit like so. Obviously you can't bend individual arms as far back. And then if the patient had another contraindication would be if the patient has received ethoxyflurane in the past week. Onset is 2 to 5 minutes and lasts up to 5 to 10 minutes, and side effects can include drowsiness, lightheadedness and nausea.